Hey guys, it's Taylor with Aspen Rehab. I have a patient with us today. We're going to leave her face out of it, but she flew in from Las Vegas, Nevada to do our fast track program for a capsular contracture treatment. So she's been with us for a week now, and she's on her last visit here, has a little more to do on her own at home, but we've gotten some really great results, and she has told us that she wants to get this out here for more consumers to know that there's a treatment plan for this non-surgically. You don't just have to go back in for surgery. So I'm going to chat with her a little bit about it. She's going to tell us about her experience throughout the whole treatment process at Aspen. So how are you feeling? It's your last day.
I'm feeling like this was such a successful trip. I just feel that I'm very, very lucky to have found you guys, and I'm about 90% recovered, and
Wow.
just looking forward to do the next 30 days at home treatment, and just to be up and running.
And
100%.
get that result back.
Yeah.
So that's awesome. 90% is such a good high margin
Yeah.
to be already. Within 5 days, she is 90% better than she was when she came to us. But let's talk a little bit about why she came to us. So obviously you had capsular contracture. Was it on one breast or both?
It was actually very mild on the right side,
Okay.
but it was a pretty bad. It's just a lot of firmness on the left side.
Okay.
And I didn't really know about Aspen then, and I opted for second surgery.
That's very common. I'm going to stop right there. People are not familiar with our program. They think that surgery is the only option, and they'll often go in for a second, third, fourth, and fifth. The reoccurrence rate of capsular contracture is very high. I believe it's something like 70%. So once you've had it, you get a revision, you have a really high chance of it coming back, because your body is basically kind of trying to, reject that implant out of there.
Right.
So is that what happened with you?
That is exactly what happened to me.
Yeah.
Unfortunately, my surgeon didn't really have any options for me except get a second surgery and let's
Revision.
just cross our fingers and hope that it works out.
Did he tell you that you had the possibility of it coming back?
He said he did, but very vaguely. It wasn't really like, it's not even 50-50. He just says, let's just hope for the best kind of situation. And in my mind, I'm thinking, it's not going to happen to me again. What are the odds, And plus, I didn't really find much online about capsular contracture, so I thought, I'm just one of those rare people. It just happened this time. It's not going to happen to me again.
Yeah, hindsight's a 20/20, because once you do your research and it's happened to you, you realize, oh my goodness, this is a lot more common than I ever expected. I know I used to not be as familiar with it as well,
Right.
and now I know that, we've treated, just in one location, we've treated over 5,000 women to date, just in the past couple of years. So it's obviously, there's an issue out there, and there needs to be a solution. So that's why we do these videos, so that you guys, we bring awareness to the table for you girls.
I think it's such a blessing. I sincerely, in my heart, thought, after it started to, capsulate again, I thought, I'm going to have to remove my breast. And to go 7 years, have a baby, want to kind of like become sexy mom again, and I want to get the larger, and then to think I'm going to have to, after all of this, take my implants out. I was already used to, my size.
Yeah, of course. Yeah.
And then to know that there was something online that could give me hope that there is maybe something, that can treat it long term where I can actually live with it and they could still be soft and beautiful and natural looking was just incredible. And I just feel like there needs to be more of this online.
Were you a skeptic of us before you came? Did you think, is this real? Is this going to work? Because, that's it. You took a gamble by flying across the country to come here to do this.
Absolutely.
So tell me about that. Okay.
I was a total skeptic. I thought, first of all, my surgeon was the first skeptic, first and foremost. He was like, it's not going to work. I've heard stories. What they do is they try to rupture the capsule, and he just honestly freaked me out. He scared me. So I was like, oh my God, this is terrible. But you guys were just in constant contact with me, reassuring me. And then honestly, what did it for me was a review on Real Self. I think it's Real Self.
Yes, we have Real Self. There's a lot of reviews, and that's done by patients.
Right.
And we do not ask them to do that. We don't pay to do that. These are just other women like you trying to inform other women that there's an option out there. And just to let you know, we do not try to break the capsule
I know.
or anything of that nature. So it's a very pain-free, easy treatment. Is it? Yeah.
It's just, it truly is a muscle. It's more
Yeah.
like physical therapy with the machine that really, allows it to kind of penetrate and get in there. So it's just like any other muscle. It went through a very traumatic experience.
That's a very good point.
Yeah, and it needs a little bit of, a little bit of massaging, a little bit of caring for it.
Yeah.
So, and I just kind of thought of it logically. I talked to my husband about it. I was like, what do I have to lose? That review was amazing. It seemed so real. The lady had gone through the same thing I did. She went through 2 surgeries.
Yes.
It came back, and so I was like, this has to work. There has to be, a solution to this, and I thought this treatment is what will help me.
And it did.
Yes.
That
I'm
makes me
just
so
so
happy.
happy.
Yeah.
I just wish more women knew about this. I always wonder about women who don't find anything online. What do they end up doing? Do they take them out? Do they just deal with hard boobs? It's so sad.
They walk around, they deal with it, they take them out, they have several surgeries.
It's
I know,
so
I
sad.
talked to women that have had 6, 7, 8 surgeries, and I think, no, stop doing that
It's
to your
so
body.
sad.
And I hate that for them. And I probably get a little irritated when I hear surgeons that put our treatment program down, because we're not in competition with them
Not at all.
whatsoever. We're working with them. We need them to do the surgery, and we do the aftercare,
Of course.
and we have a prevention treatment as well.
Right.
So, that's on another side, but we work with them, not against them. So when your doctor tells you things like they're gonna hurt you, or they're gonna do this or that,
Don't waste your money. Yeah.
that's an ignorant statement, because you're uneducated on what it is that we do. So education is key, and you doing this with me helps us to get that out there, and I really appreciate it.
Of course.
And we'll continue on our end to fight to get it out there.
I think the most exciting thing for me is after I'm done with my, at-home program, I want to go back to my surgeon, because he was kind of like, oh yeah, okay, yeah, you come back and let me know how that worked out for you, good luck kind of thing.
Yeah.
I am so excited to go back to Beverly Hills and be like, Doc, it worked out for me.
Yeah.
Like, can you please provide this to your patients?
Right,
Like, can
because
you provide this machine there?
This
and
is where
you get
we
the
do
treatment?
offer it for plastic surgeons to purchase.
Absolutely.
So they can put this in their office and treat every patient that has a breast augmentation.
Right.
Prevention, or if they do develop a capsule in the future.
I think it would be
Everyone
amazing
should own it. Every single surgeon
Every
should have this in
surgeon.
their office, yes.
to have that as an option, besides a surgery. It's so expensive.
Yeah.
It's so stressful, and it really takes a toll on you as a patient.
It does.
You go there to feel better about yourself, and then you come out feeling worse. So
I know, and
it's very
it's so
stressful.
frustrating.
Yeah.
Thank you so much for this. I really appreciate it. Safe travels back home, okay, sweetheart?
Thank you.
Thank you.